The ASCO 2022 meeting had an incredible amount of new data presented, but there were a few abstracts that stood out to me as being quite impressive and noteworthy for us to focus on going forward. The first was the SHINE clinical trial. This was a randomized placebo-controlled phase 3 study presented by my colleague, Dr. Michael Wong, looking at patients over age 65 with newly diagnosed mantle cell lymphoma. Patients were treated with Bendamustine Rituximab, and half the patients received a placebo with that, half of them received Ibrutinib with that. And what the investigators identified was that the Ibrutinib significantly improved outcomes for patients treated with Bendamustine Rituximab, having a major improvement in the progression-free survival. The hazard ratio was 0.75 and a nearly 2.5-year prolongation of the median progression-free survival. A major advance. And this was published just recently in the New England Journal of Medicine, and in my opinion, should be a new standard of care option for patients who are newly diagnosed who cannot tolerate intensive chemotherapy. The other abstracts that I thought were quite noteworthy were two different abstracts looking at racial disparities, healthcare disparities of patients treated with standard therapies as well as with oxycaptogene Solucil, and identified that we don't have enough patients with different minority backgrounds on our clinical trials. But when we look into large data registries, we can find that unfortunately overall survival appears to be lower in some of our minority groups, specifically African-American population in the United States. But when they corrected for different socioeconomic factors, patients' access to healthcare likely was the determining factor, because the overall survival difference disappeared when correcting for these social determinants of health. It was back to being equivalent, implying that that might be a surrogate for poor access to healthcare, something that's certainly a problem in the United States, that certain patients are not able to access the same care as others. In the Axicell group, they identified that patients of African descent, African-American patients, looked like they had lower response rates and lower progression-free survival than patients of Asian descent or Caucasians. Perhaps that could be due to differences in tumor biology, but it may also have to do with access to care and receiving care at a later time point. So clearly a lot left to work on in terms of improving racial disparities. So a lot of exciting updates from the ASCO 2022 meeting for patients with lymphoma.